let me just say a few things about sort of the general approach. One is the importance of normalizing mental health, creating multiple pathways. The workforce is very diverse. What may work really well for physicians might not work really well for people who are frontline workers working in, say, the cafeteria. And so thinking about different strategies for different parts of the healthcare workforce are really important. Incorporating health promotion and wellness activities. I give you an example of that. Utilizing a strength-based approach, because one of the things that we've seen with veterans, for example, is we talk about wounded warriors, right? So that's a reframing of what happens to people when they are traumatized that really emphasizes the strength that people bring to these situations. And always thinking that way and using that kind of language can be very important in terms of reducing stigma and making it more likely that people will participate. Using data and collecting data. If you are running a healthcare organization, you have to know what proportion of your workforce are accessing your EAP, your mental health benefits, just to have a baseline and to guide your work. And then the last point is that it's really important to think about operating at multiple levels within your organization. What are the individual interventions that you might want to do? What are the more organizational interventions? And then what are some of the policy issues? I really like the presentation from AMA, because they were talking about policies like the questions that one asks on the application that can be an inhibitor. So thinking at all three of those levels can be very important. So with that, I will just end by saying, yes, we have a huge challenge, but we also know a lot about how to address that challenge. And a lot of the things that we can do to address the exacerbation that we've seen in mental health challenges during the pandemic are things that are not only going to help us today, but they will lay a very strong foundation for how we protect the mental health of our workforce going forward.